General, I guess, principle or concept that I hope to relay is that, of course, the development of CAR T cell platforms for T cell malignancies is much more complex and challenging than using T cells to target B cell malignancies. And so this really is just a story that shows how we went from our initial CAR construct of CD5 CAR T cells. And while there was great safety seen, the efficacy wasn't, very good initially. And then just based on correlative analyses that we did and looking at the product characteristics, we were able to modify our manufacturing process to incorporate using TKIs, which ultimately resulted in a much more potent product that led to increased responses in a second cohort of patients that use this manufacturing method. So it's a phase 1 study, dose escalation study, where we use autologous derived, meaning we collect the T cells from the patient themselves, CAR T cells. And then I guess one of the nice things about our study is that we were able to collect these CAR T cells just from peripheral blood collections. We didn't require apheresis in order to obtain the starting material. And then patients, the cells were manufactured, and then once the appropriate dose level was reached, cells were frozen until the patients were ready to come. The patients then got standard lymphodepleting chemotherapy with fludarabine and cyclophosphamide, followed by the CAR T cell infusion, usually within 24 to 72 hours after completion of the lymphodepleting chemotherapy. So in the initial cohort, where we used our manufacturing process that did not include the use of TKIs, we treated a total of 8 patients. And out of that 8 patients, there was only 1 complete remission that was observed. And unfortunately, it was a transient remission. So the patient ultimately had progressive disease at around 4 to 6 weeks after the initial remission. And so at that point, we kind of reassessed, validated the manufacturing process using the TKI inhibitors, which ultimately what these inhibitors do is that they mute the tonic CAR signaling in the T cells, preventing fratricide and exhaustion, so that when the product is finalized, we end up with a more naive phenotype of cells, which are ultimately more effective. And when these inhibitors are washed off, they regain their cytolytic and effector functions very rapidly and at normal baseline compared to non-transduced normal T cells. And so in the second cohort, we treated a total of 7 patients. Part of this cohort, the patients had CAR T cells manufactured from their own cells. And then we also added an allogeneic or donor-derived arm where we made the CAR T cells from their prior stem cell transplant donors for patients who had relapsed after transplant. And in this cohort, we saw 4 complete remissions out of 7 patients that were treated. So we went from a 13% response rate to 57%. And 2 of these patients ultimately went on and received allogeneic stem cell transplantation after achieving remission. in terms of that, at least compared to like the CD19 products. We didn't have any grade 3 CRS events. All of the CRS events that occurred were primarily grade 1, and then there was one grade 2 event, and there was only one patient that actually developed neurotoxicity, after receipt of the CAR T cell. So in terms of that safety component, I think that's very encouraging because I think we expected to see more toxicities. Not really sure why. Maybe just because it's a T cell on T cell
Yeah.
product. And we also really did not see a significant increase in other infections. So there were some transient viral reactivations of like CMV or BK, which we monitored all of these viruses very rigorously, but most of them just kind of were low-level reactivations that self-resolved without needing any specific treatment instituted. So, early data, but it's exciting, and hopefully, we'll be able to continue pushing this therapy forward so that we can offer it to a broader source of populations. The one thing I will say is that for people who may have patients that would be eligible, refer early, because the earlier we get these patients, I think the better.